You know, when we think about someone recovering from a stroke, we usually picture this long, slow process, something that starts weeks, maybe even months after it happens. But what if that whole idea is fundamentally wrong? What if recovery is actually a race against the clock that starts the second a stroke happens? Today, we're going to dig into the clinical research files of Dr. Luis Campanella. And what we're going to find is a completely different way of looking at the brain after a stroke, and more importantly, what we can do about it. Okay, get this quote, because it changes everything. It's not that the patient has forgotten how to move. The brain knows how to walk. It remembers how to lift an arm. The real problem is that the command chain, the signal from the brain to the muscle, is broken. The line is completely down. So, to really wrap our heads around this, we need to think about the brain in a new way. It's not just one big thing. It's this incredibly vast, interconnected network. A stroke isn't just a localized injury. Think of it more like a massive earthquake that hits a city and just wipes out all the key bridges and highways. The destinations, the muscles, they're still there. And the command center, the brain's memory of how to move, that's still there too. But the pathways connecting them, they're destroyed. The entire communications network has collapsed. And that idea of a collapsed network, well, it leads us to a really critical point. If all the roads are out, what happens if we just sit back and wait? The choice here is it's incredibly stark. On one side, you've got active intervention. We get in there, we start rewiring those neural networks, and we fight for every ounce of independence. But on the other side, the path of inaction, well, those networks just go dark. They go dormant, and that leads to permanent paralysis and a whole host of other serious health problems. And the cost of waiting is truly severe. I mean, when those neural networks are just left alone, they start to wither away. And this doesn't just mean paralysis. We're talking about muscles wasting away, joints locking up in these painful positions, and even life-threatening complications like pneumonia. It is a completely devastating outcome. But, and this is a huge but, it doesn't have to be that way. Because if the old network is broken, the brain has this amazing, almost magical ability to build a new one. It just needs a little help. It needs a guide, an architect, if you will. So the big question is, how does this actually work, right? How can a brain that's been damaged somehow be convinced to forge entirely new connections just to get a signal from point A to point B? Well, the answer has this really cool name, neuroplasticity. Honestly, you can think of it as the brain's own superpower. It's this built-in ability it has to reorganize itself, to form brand new connections and create new pathways to get around damage. And this isn't something that just happens. It is the active, nuts and bolts process of rewiring the brain. And this is where the physiotherapist comes in as that architect of recovery. See, they aren't just a coach leading some exercises, no way. They are a neurological guide. By providing really specific physical inputs, they're basically sending signals into that collapsed network, which forces the brain to try and find a new way around the damage. So here's how it goes down. First, the therapist will physically move the patient's paralyzed arm or leg. That simple movement sends a sensory signal zipping back to the brain. The brain gets that signal and it's basically challenged, right? It's like, whoa, a signal just came in from the arm, but my main highway is totally wiped out. I gotta find another route. And then, through repetition, doing it over and over, the brain starts to forge and then strengthen a brand new pathway. It's kind of like blazing a new trail through a dense forest. Now, this entire process is absolutely incredible, but its success, it really hinges on one super urgent factor: timing. So let's think about that. If we're trying to wake up these sleeping connections and build new ones from scratch, when is the absolute best time to start sending those first signals? Immediately. The clinical data on this is crystal clear. This is not something you wait on. It's not for some outpatient clinic months down the road. The real work of rewiring the brain has to begin the moment a patient is medically stable, often right there in the ICU or the acute stroke unit. You have to think of it like a window of opportunity. The sooner that physical mobilization begins, the better our chance is of tapping into those sleeping connections before they go dormant for good. It's a direct line. Early action equals better outcomes. It's that simple. Which, really, it brings us to the core philosophy here, the true goal of modern stroke rehab. And this might be the most powerful takeaway of all. The damage from the stroke is done. We can't turn back the clock. But the story doesn't end there. The goal is to get in there aggressively and immediately. and maximize every single bit of potential that is left in that brain and in that body. Ultimately, when you boil it all down, it comes to this simple but incredibly profound truth. In the world of stroke recovery, movement isn't just exercise, it's the medicine. It's the very thing that stimulates the brain to heal itself. It's the catalyst for the whole rewiring process. And that leaves us with one final, critical question to think about. If we know the brain has this incredible built-in capacity to adapt and to heal, and if we know that capacity is switched on by physical input, then is just sitting back and waiting ever really an acceptable option?